The clinical research program was a combined effort between the Alliance for Clinical Trials, NIH-funded group, and the American College of Surgeons. Part of the outgrowth of their work was to say we could take the evidence that exists for how cancer surgery should be done, and put that into standards. And in fact, that's what happened. So it was an organic growth of new evidence, new knowledge that came out of the clinical research program. And then the Commission on Cancer, one of the accreditation programs, plus recently the NAPRC, adopted the standards and said, these are important. These standards tell us what really matters about the conduct of surgery. In addition to supporting standards in the accreditation programs, the tools that we're developing in Cancer Surgery Standards Program will help automate data acquisition into the National Cancer Database. And we use AJCC language. So it really has a touch point with every single program in the American College of Surgeons cancer programs. There's enough literature and high quality evidence to show that precise parts of surgery, the conduct of surgery, what you do in the operating room, should be attended with care and attention because of the impact that they have on the patient outcome. If you don't get the tumor out completely, you leave some behind, or you don't do an en bloc resection, then you're going to leave cancer behind and the result is not going to be favorable. If you don't do adequate adenopathy removal of lymph glands, then you're going to find that the patient has understaging potentially, or has residual disease that of course can just regrow and become problematic. It's important that surgeons conduct the operations according to these standards that help guide what's really important about the operation from a cancer outcome perspective. And that's what's being implemented now. They were adopted by the Commission on Cancer, and then we just have to have a way of monitoring it so that we can see what the outcomes are and do quality improvement as a consequence of having the standards. So you set a standard in, you monitor it, and then you see what the outcomes are, and you can improve care over time. That's the sort of continuous improvement life cycle that we'd like to support with these standards. One other feature of the timing, in my opinion, is that we will be bringing forth synoptic operative reports as a new digital tool to not only help surgeons be reminded to document all these aspects of surgery that are important, whether you've got a complete resection, findings you may have observed at the time of surgery that are important to staging or important to future care. And because there's an EMR, we can make it digital and we can make it a just-in-time tool for documentation. And for those that think the regular documentation is adequate, it was historically, but it's not really anymore what I would consider to be state of the art. And when you look at narrative reports, up to 50% of vital information is missing, and you can capture 100% of that when you use more of a checklist type tool. Now, nobody likes checklists per se, but they do serve both an educational and a quality purpose. For young trainees, it tells you what you should be focusing on. For the provider who's experienced, it's just sort of a reminder, please make sure and document this so the next provider in the cancer care continuum can know what you did and what you found. So it's really an important communication. That's what we're trying to do in a very user-friendly way, to create tools that will allow the clinician to put in the information that really is important. So it goes from clinical information into clinical data that can then tell us how we're doing in our clinical practices. And that's a frame shift and a mindset difference that will take some time for us to work through with clinicians who might otherwise be a little bit reticent to go in that direction. But it is innovative for how it's delivered and what's delivered. Nobody would look over your shoulder before and say, well, these are the really important things. Now, every surgeon intuitively knew that if you left tumor behind, that wasn't a good thing. But this calls it out a little bit more, and particularly for the younger generation, where the amount of information they have to handle on a day-to-day basis exceeds cognitive capacity of people. This is a little bit of a reminder in the record of what it is that should be the focus. It's a little bit of a change in that regard, rather relying on your brain to carry everything all the time these are ways of sort of thinking through either ahead of the operation or at the end, just to remind you to record it for others to be able to get that communication in the documentation.